Good day. We are the Team TG and we will present our proposed research entitled Development of Data Gathering by Mapping for the COVID-19 Action Plan and Study in the Province of Bataan. Here is the outline of our presentation. The Chapter 1 includes background of the study, statement and objectives of the problem, significance of the study, and conceptual framework. To understand more further the proposed study, here's the background of the study. COVID-19 pandemic affecting millions of people rapidly spread to other parts of countries around the world. Really shows a significant rise in total cases resulting in widespread dissemination that pose significant threats to human health, production, life, and social functioning. To be specific, Bataan is one of the affected provinces by the COVID-19 pandemic. The containment of the disease all over the province greatly affected the social and welfare of the residents. Despite the situation happening, the mapping will help to reduce the risk of COVID-19 and combating the disease. It is essential to understand the outbreak to develop and manage the process in mitigating the spread of the disease. Amidst this pandemic, the need for reliable information on the COVID-19 outbreak increases. However, COVID-19 mapping and surveillance of emerging health threats as it also collates outbreak data from a range of sources in which different data were considered for the prediction to be sufficiently accurate. In this study, we aim to produce a map ideal for the province of Bataan.
This is the map showing towns in the province of Bataan. Here is the map showing the collected data of confirmed cases, recovered patients, and deaths from the months of March to October 2020. The problem presented is due to the rapid spread of COVID-19. The number of cases continues to rise, especially in the province of Bataan. The local government units were not prepared for this. The availability of the data is important in quantifying the susceptibility that give insights for timely and effective epidemic monitoring and response. To understand the aim of this study, here is Ms. Guanzon.
The main objective of this research is to understand how the outbreak increases and spread out fast in the province of Bataan over a certain period of time. And the specific objectives of this study are to determine the places that have been the highest risk and increase in COVID-19 cases, to give the public an accurate information with available reliable facts about the current situation, to introduce mapping as an easier way of gathering data for our frontliners to help them trace and monitor the active cases of COVID-19. This study can help limit the dissemination of the false news to the public in giving information about the current status of COVID-19 pandemic in the province of Bataan. To know more about the importance of this study will be discussed by Mr. Tagle.
These are the following who will benefit of this research. First, the residents. Due to the increased risk brought by the COVID-19, the study provides reliable and accessible information that generates the collected data that can be disseminated by the local authorities. Second, the local government. The study will provide the local government by presenting readily provided information to evaluate and understand the risk and containment of COVID-19, which result to mitigate the fatality of individual over a period of time. The data collected can be used as a potential guideline for the development of the risk of an outbreak. And last, future researchers. Maps developed for the study can help future researchers to gather data, whereas on the other hand, the knowledge provided possible used to establish a system of data collection and mapping of outbreak. In turn, may further increase the resilience of the province. To explain the paradigm of this study, here is Ms. Ong Kim-Pro.
Presented on the screen is the framework containing the structure of the direction that the researchers should take and how it should be performed. The secondary data will be used and collected comes from different resources. It will be inputted in the Geographic Information System or GIS and will be processed to produce a GIS-based map for the COVID-19 outbreak. To deeply understand and identify the research gap, here is Ms. Mamariel to explain the review of related literature.
Here's the chapter 2 of our presentation, the review of related literature. First is the COVID-19 outbreak. The objective of the related study that we've searched is to measure the occurrence of COVID-19, its magnitude, and territorial spread, while the objective of our study is to determine the places that have the highest risk and increase in COVID-19 cases in the province of Bataan. Second is the data gathering of COVID-19 cases. The related study is to understand why individuals believe and share false COVID-19 related knowledge and to establish steps to improve the quality knowledge that individuals post online. While our study is to give the public an accurate information with available reliable facts about the current situation in the province of Bataan. Third is the Geographic Information System or GIS. The related study is to develop and maintain a mature relatively quickly and adopts an accurate technological route for data preparation, platform construction, model construction, and map production. While our study is to introduce mapping as an easier way of gathering data for our frontliners to help them trace and monitor the active cases of COVID-19 in Bataan. And lastly is the fake news. The related study is to recognize factors that can affect the actions of social networking sites when finding false information. While our study is to help limit the dissemination of false news to the public in giving information about the current status of COVID-19 pandemic in the province of Bataan.
That sums up our presentation. Thank you.